that Republicans won't support. Democratic Congresswoman Linda Sanchez of California now joins us. Congresswoman Sanchez, good to see you.
Thank you for having me.
So, Congresswoman Sanchez, where do you see the debate going from here, given what seems to be very little Republican interest in bipartisanship? Do you see this as a Democratic-only effort? And if so, does that ultimately impact the actual policy that comes out of both the House and the Senate?
Well, it's interesting because, as my colleague Congresswoman Waters mentioned, I think that President Obama has really gone the extra mile and bent over backwards to try to bring Republicans to the table, have them propose ideas, and work with them to craft bipartisan legislation. And I think increasingly what we are seeing is they really don't have an interest in putting forth any new ideas of their own. They just are pretty much vetoing and saying no to everything that we are proposing. There's not really a lot of meaningful dialogue, and whole segments of Republicans in the Congress have just said no out of the gate, and they're not interested really in negotiating anything. So now we turn to the fact that we are in an unprecedented time in terms of our health care crisis, and we cannot afford the status quo. The system is limping along. It's not doing its job, and as premiums continue to rise, fewer and fewer people will be able to afford coverage. We have an unprecedented also opportunity to fix this problem because we do have a Democratic majority in both houses. So I think that, as Republicans continue to reject and misrepresent parts of a very admittedly big and complex bill, I think we now need to look internally to how can we come to consensus, come up with a version of the bill in the House, because right now there are 2 or 3, and work with the Senate to craft something that can be passed in both of the houses.
If you had one area where you think you have the best chance of gaining some Republican support, what piece of this very complicated legislation would you focus on?
Well, it's interesting because, all this, there are a lot of moving parts, and so it's hard to exactly pin down, and certain things are deal breakers for some members. I just want to make this comment. I serve on the Ways and Means Committee, and in that markup of our version of the bill, it was Republicans who were really insisting on the quality of life and end-of-life care counseling, and somehow that got twisted, and it became, oh, Democrats, are going to kill your grandmother, which is completely false, completely inflammatory, and completely misleading, and yet that was a proposal that we tried to incorporate it at the request of a Republican member. So,
Congresswoman Sanchez, I want to leave health care just for a moment. Sure. I know that you and other members have had some time in your district over the last couple of weeks. What other issues are constituents concerned about and talking to you about? And what else do you think should be on the congressional agenda when you guys return in just a couple of weeks?
Well, I'll tell you, I've been doing a number of public events, and pretty much healthcare reform has dominated the discussion because people really are hungry for information. And I find once you engage with them in a productive way, not screaming and shouting, but actually discuss, people are very interested in hearing what we have to say and what we've been working on. But I think some of the shouters and some of the people that are being disruptive when we're trying to talk about certain themes, I think they're just generally frustrated with, maybe the status of the economy. They're upset and they're angry, but they're channeling that anger into sort of this, healthcare reform is kind of the whipping boy for it all. But if I had to sort of say, besides healthcare reform, I mean, people are generally concerned about economic stability, and a lot of folks are concerned about keeping their job, or, retirement security is also a big issue that I hear a lot about.
Congresswoman Sanchez, thank you so much for joining us, and I hope you'll come back again soon.
My pleasure. Thanks for having me.
Thank you. Straight ahead, the Taliban's